Hello and welcome to this channel. In this video, we will talk about pleural effusions. What does effusion mean? Effusion refers to the escape or seepage of fluid from its usual location into an area where it does not normally reside. In the context of medical terminology, an effusion typically refers to the accumulation of fluid in a body cavity or space, such as the pleural space around the lungs or the joint space in a joint. This can be caused by various underlying medical conditions, such as inflammation, infection, trauma, or cancer. Effusions can cause symptoms and complications depending on their location and severity, and they may require medical evaluation and treatment. What is the pleura? The pleura is a thin membrane that lines the chest cavity and covers the lungs. It consists of two layers, the visceral pleura, which is the inner layer that covers the lungs, and the parietal pleura, which is the outer layer that lines the chest cavity. Between the two layers is a small amount of fluid that acts as a lubricant, allowing the two layers to slide smoothly over each other during breathing. The pleura plays an important role in protecting the lungs and facilitating their movement during breathing. Disorders affecting the pleura, such as pleural effusions or pleurisy, can cause respiratory symptoms and may require medical evaluation and treatment. So how do we define pleural effusion? Pleural effusion is the accumulation of fluid in the pleural space, which is the space between the lungs and the chest wall. It can be a sign of an underlying medical condition and can cause respiratory distress. Is any amount of liquid in the pleura abnormal? Normally, there is a small amount of fluid in the pleural space, so the space between the visceral and parietal pleura, that acts as a lubricant, allowing the two layers to slide smoothly over each other during breathing. The amount of fluid present in the pleural space is normally around 0.1 to 0.2 milliliters per kilogram of body weight, which is approximately 5 to 15 milliliters as an adult. This small amount of fluid is constantly being produced and reabsorbed by the pleural membranes. However, if there is an imbalance between the production and reabsorption of fluid, or if there is an underlying medical condition, such as heart failure or pneumonia, excess fluid can accumulate in the pleural space, resulting in pleural effusion. The amount of fluid in a pleural effusion can vary widely, from a few milliliters to several liters, and can cause respiratory symptoms and complications. Let's now talk about the pathophysiology. Pleural effusions can be caused by several underlying conditions. Those include, first, as mentioned, heart failure. Congestive heart failure can cause an accumulation of fluid in the lungs and pleural space. The second cause is pneumonia. Bacterial or viral infections of the lungs can lead to the production of excess fluid in the pleural space. Also, various types of cancer, including lung cancer, breast cancer, and lymphoma, can cause pleural effusions. A pulmonary embolism, which is a blood clot in the lungs, can cause inflammation and fluid accumulation in the pleural space. Also, kidney disease can lead to pleural effusion. Conditions such as nephrotic syndrome and renal failure can cause fluid buildup in the pleural space. Liver disease is another cause for pleural effusion. Liver failure can lead to an accumulation of fluid in the abdomen, which we call ascites, which can put pressure on the diaphragm and lead to pleural effusion. Conditions such as lupus, rheumatoid arthritis, and sarcoidosis, so autoimmune diseases, can cause an inflammation and fluid accumulation in the pleural space. Also, injuries to the chest can lead to a buildup of blood or other fluids in the pleural space. Certain medications, such as chemotherapy drugs, can cause pleural effusions as a side effect. And in some cases, the cause of pleural effusion may not be known. known as idiopathic pleural effusion. In the next point, I would like to talk about the types of pleural effusion. The amount and composition of the fluid can vary, so we divide pleural effusion in different types according to the characteristics of the fluid that accumulates. These types include: first, transudative pleural effusion. This type of effusion is caused by an imbalance of fluid pressure or electrolytes, and the fluid that accumulates in the pleural space is similar in composition to blood plasma. Transudative pleural effusions are typically associated with conditions such as heart failure, liver cirrhosis, or kidney disease. The second type is exudative pleural effusion. This type of effusion is caused by a leakage of inflammatory or cancerous cells and proteins into the pleural space, and the fluid that accumulates is often cloudy or milky in appearance. Exudative pleural effusions are typically associated with conditions such as pneumonia, tuberculosis, lung cancer, or autoimmune diseases. The third type is hemothorax. This type of pleural effusion is caused by the accumulation of blood in the pleural space, often due to trauma or injury to the chest. The fourth type is chylothorax. This type of pleural effusion is caused by the accumulation of lymphatic fluid in the pleural space, often due to injury or obstruction of the thoracic duct. The fifth type is empyema. This is a type of exudative pleural effusion that is caused by a bacterial infection in the pleural space. The fluid that accumulates is often pus-like in appearance. And the last type is malignant pleural effusion. This is a type of exudative pleural effusion that is caused by cancer cells that have spread to the pleural space. The fluid that accumulates is often bloody or cloudy and may contain cancer cells. The type of pleural effusion can provide important clues to the underlying cause of the condition and may guide treatment decisions. What are symptoms of pleural effusion? The symptoms of pleural effusion can vary depending on the amount of fluid in the pleural space and the underlying cause of the effusion. Some common symptoms of pleural effusion include shortness of breath. This is the most common symptom of pleural effusion. The buildup of fluid in the pleural space can make it difficult to breathe, particularly when lying down. Also, chest pain can be seen in some people with pleural effusion, as they might experience chest pain which can be either sharp or a dull ache. A persistent cough may develop as a result of irritation of the lung or the lining of the chest. The cough is typically a dry cough. A fever may develop if the effusion is caused by an infection. Another symptom is fatigue, so a feeling of feeling tired or weak may be a symptom of pleural effusion, particularly if it is severe. Some people with pleural effusion may experience wheezing, which is a high-pitched whistling sound when breathing. Also, the loss of appetite or feeling full quickly may occur due to the pressure on the stomach from the pleural effusion. In severe cases, pleural effusion can cause a person to feel extremely short of breath and require emergency medical attention. How can we diagnose pleural effusion? The diagnosis of pleural effusion typically involves a combination of physical examination, medical history, and imaging tests. Here are some of the diagnostic tools commonly used to diagnose pleural effusion. First, the physical examination. A doctor usually will listen to the patient's lungs with a stethoscope to check for the presence of decreased or absent breath sounds, and may tap on the chest to check for dullness, which can indicate the presence of fluid. A chest X-ray can show the presence of fluid in the pleural space and can help to determine the size and location of the effusion. A CT scan can provide a more detailed image of the lungs and pleura and can help to determine the cause of the effusion. An ultrasound can provide real-time images of the pleural space and can help guide the placement of a needle during a diagnostic or therapeutic procedure. This procedure is usually thoracocentesis, in which a needle is inserted through the chest wall to remove a sample of fluid from the pleural space. The fluid can be analyzed to help determine the cause of the effusion. In some cases, a small sample of tissue may be removed from the pleura in a pleural biopsy for further analysis to help diagnose the underlying cause of the effusion. In the next point, I would like to talk about the treatment. The treatment of pleural effusion depends on the underlying cause and the severity of the effusion. Thoracocentesis is one of the treatment options. This procedure involves the insertion of a needle into the pleural space to drain the accumulated fluid. Thoracocentesis can relieve symptoms such as shortness of breath and chest pain, and can also provide a sample of the fluid for further analysis. Pleurodesis is another treatment option. This is a procedure in which an irritant substance is injected into the pleural space to create inflammation and scarring, which can prevent fluid from accumulating in the future. Pleurodesis is typically used in cases of recurrent pleural effusion. Antibiotics can also be used in the treatment. If the pleural effusion is caused by an infection, antibiotics may be prescribed to treat the underlying infection. Chemotherapy or radiation therapy. If the pleural effusion is caused by cancer, chemotherapy or radiation therapy may be used to shrink or destroy the cancer cells. In some cases of pleural effusion, surgery may be necessary to remove the pleural tissue or the lung in order to relieve the pleural effusion. If the pleural effusion is caused by heart failure or kidney disease, diuretics may be prescribed to help reduce fluid buildup. In addition to these treatments, supportive care such as oxygen therapy and pain management may also be necessary to relieve symptoms and improve quality of life. What are complications of pleural effusion? Pleural effusion can cause a number of complications, especially if left untreated. These are some of the potential complications. Respiratory distress. As pleural fluid accumulates, it can put pressure on the lungs, making it difficult to breathe. This can cause shortness of breath and respiratory distress, especially during physical activity. Infection. If bacteria or other pathogens are present in the pleural fluid, it can lead to an infection called empyema. This can cause fever, chills, and difficulty breathing, and can be life-threatening if left untreated. Lung collapse. In severe cases, the pressure from pleural fluid can cause the lung to collapse, a condition called pneumothorax. Chronic cough. As pleural fluid accumulates, it can irritate the lining of the lungs and cause a persistent cough. If pleural effusion is not treated promptly, it can cause scarring and thickening of the pleura, which can make it difficult to breathe and cause chronic chest pain. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you very much for watching, and hopefully see you again in the next video.